Did you know that high blood pressure is often described as a silent condition? This is because most people with high blood pressure do not have any symptoms. The disease is silent. Keeping your blood pressure in a normal range can help prevent stroke, heart attack, damage to your kidneys, and other diseases. In this video, we'll review what blood pressure is, how to check it, and how you can manage high blood pressure so you can stay healthy. Blood pressure, sometimes called BP, is the force of blood inside your body's blood vessels. When you have your BP checked, there are two numbers to understand. The higher number, or systolic, is the pressure blood puts on your blood vessel walls when your heart is working the hardest and pumping blood to the rest of the body. The diastolic, or the bottom number, is the pressure measurement when the heart is resting between contractions. Both numbers provide important information about the condition of your heart and blood vessels. The American Heart Association tells us a normal BP is below 120 systolic over 80 diastolic. Depending on your health conditions, a slightly higher or lower number may be okay. Our blood pressure changes often based on what we are doing and what our body needs. The walls of our arteries and veins are flexible, and like muscles, they can tighten down or expand when needed. The walls of our blood vessels respond to many different triggers. Some triggers are healthy, and some are not healthy. When blood pressure is elevated, such as from an unhealthy trigger like smoking, it causes damage to the blood vessels, heart, and other organs. Getting older can cause the walls of our arteries to stiffen and lose flexibility, and this can increase our blood pressure. Measuring your own BP at home is the best way for you to keep track of your blood pressure. Record the blood pressure readings each time, and as often as your provider instructs you to check your blood pressure. Make sure you bring the record of BP readings with you when you see your healthcare provider. You can check your BP at most pharmacies if you do not have a home machine. If you have a blood pressure machine, it's a good idea to bring your machine with you to compare home readings with readings at your healthcare provider's office. Measure your blood pressure at different times of the day and record it, including what time of day you took your blood pressure. Ask your healthcare provider what your target blood pressure is. Depending on your health conditions, a slightly higher or lower number may be okay. Let's review the steps of measuring blood pressure with a home monitor that measures blood pressure in your arm. Sit down and stretch your arm out on a table. Your arm should be at the level of your heart. It's best to wait a full 5 minutes in a seated restful position before you take your BP. It's best if you have not had any caffeine or nicotine within 30 minutes of taking your BP. Uncross your legs. Wrap the cuff around your upper arm with the cord positioned at the inside groove of your elbow. You should be able to fit no more than 1 to 2 fingers between the cuff and your arm. Press the start button and keep your arms still while the machine is working. Record the result in your log. High blood pressure can be caused by things we cannot change, such as age, race, and our gender. These are called non-modifiable risk factors. But in many cases, high blood pressure can also be caused by habits we can change, such as smoking, eating a high-salt diet, being overweight, excessive alcohol intake, being physically inactive. These are called modifiable risk factors. Addressing these factors can help you decrease your blood pressure, such as by quitting smoking, maintaining a healthy weight, reducing alcohol intake. You can also reduce your blood pressure by reducing your salt intake. This can be done by avoiding packaged foods and canned foods, reading food labels and avoiding foods with a high sodium content, sticking with a diet of fresh foods, including lean meats, fruits, and vegetables, and using seasonings like pepper or herbs instead of adding salt to foods. Finding ways to be physically active every day is also important. Start slow, like increasing time spent walking during the day or doing activities you enjoy. Always talk with your healthcare provider before starting an exercise routine. When changing your modifiable risk factors is not enough to keep your blood pressure under control, you may need to take medication. There are several types of blood pressure medications, and they work in different ways. Sometimes more than one medication is needed to have the best effect. Some medications are combination medications. This means that 2 different medications are combined in one pill, each working in a different way. Don't stop taking your BP medication without talking to your doctor first. If a medication is causing side effects, talk with your doctor or pharmacist. Ask about what can be done. Also, it's important to know that side effects may go away on their own within a few weeks of starting a new medicine. You can help to manage your health by keeping your blood pressure in the target range. Know your blood pressure goal numbers. Keep track of your blood pressure and inform your doctor if your numbers are not in this range for most readings. Other things you can do to help manage your blood pressure include quitting smoking, reducing salt intake, losing weight if you're overweight, reducing alcohol intake, exercising regularly, and taking your blood pressure medicines as prescribed. The medication your provider prescribes for you will keep the blood pressure just right in your body. Engage with your healthcare team if you have questions about your BP goal, numbers, medication, or making other lifestyle changes.